Okay. Assalamualaikum, salam sejahtera. Welcome everybody. Saya Dr. Jamila Mahmud dan selamat datang kepada episod pertama di Facebook Live for Apa Kata Science or Sense with Science. As you can see, I'm doing Dui Bahasa today so that we can reach people who can speak both PM and English. And with me today,
saya Profesor Adiba Kamarul Zaman dari Universiti Malaya. Saya seorang pakar penyakit berjangkit. Dan ini adalah episod keempat ya, Sense with Science atau Apa Kata Science. Tapi pertama kali di Facebook Live, dan tujuan kita hari ini ialah kita ada special guest hari ini.
Ya. Adiba, mungkin you boleh beritahu kenapa kita membuat series Sense with Science atau Apa Kata Science?
Ia bermula dari satu perbualan pada hari petang Ahad macam ini antara saya dengan Tan Sri. Sebelum tu, saya rasa sehari sebelum International Women in Science Day. Kebetulan besok ialah International Women's Day ya Tan Sri. Tapi a few weeks ago it was International Women in Science, dan saya dan Tan Sri tengah berkongsi pendapat supaya kita harus celebrate International Women and Girls in Science, dan pada pendapat kami cara paling baik ialah dengan berkongsi fakta-fakta sains berkenaan dengan COVID-19 ya. Sebabnya kita sudah menjangkau 1 tahun dengan pandemik COVID-19 ini, dan sememangnya sains dalam COVID ini, saya seorang saintis, seorang doktor pun susah nak keep up dengan hari-hari keputusan-keputusan dari penyelidikan di merata dunia, dan kami berhasrat untuk to make that science accessible kepada semua, dan especially supaya kita dapat use that science dalam kehidupan kita sehari-hari untuk mengelak daripada dijangkiti COVID-19, dan juga sekarang musim kita semua di vaksin ya. So I think some of the discussion hari ini pun akan mungkin tertumpu sedikit kepada vaksin, tetapi sekali lagi kita ada seorang tetamu khas petang ini ya Tan Sri.
Yep, kita ada tetamu khas. We have a very special guest, Puan Zainuriah Abdul Rahman, or we call her Zai. So Zai, welcome to Sense with Science. We are so grateful to you to join us today. Dan mungkin Zai, you can just start by telling us a little bit about yourself.
Okay. Thank you very much for inviting me. I'm really honored to be on this program. The fact that because I have been involved with community events and doing work for the community, particularly for children and youth. So being in this program allows me also to share, and also hopefully that whatever that I can share and whatever that we discuss today would benefit as many people as possible. My background is in corporate communications, and but then I have been doing a lot of NGO and charity work in the past, but coming to this age, I'm 63 this year, so I feel that I would like to do something a little bit less than what I did before, but then at the same time still helping children or raising funds for youth and children who needs help, and I besides establishing a social enterprise that's called enabling the young, helping the young. I'm also with Sukita, and that is the charity arm to help raise funds. So that's just about my passion and what I've been doing so far.
That's wonderful.
Thank you.
Congratulations. Yeah. So You know, one thing we notice is a year into the pandemic, and I think the people, the rakyat, including, even healthcare workers, are getting what we call pandemic fatigue. Yeah, being told, you must keep your distance, you must clean your hands, you must wear masks all the time, you must not do this, you must not do that. And we're also worried that people are getting numb to the numbers, 1,000 new cases, 3,000 new recoveries. I think Tan Sri and I felt that it's very, very important to put a face to those numbers. I'm not sure if you know, but my background is also in HIV/AIDS, and it's the same thing. 30, 40 years ago, people just became numb to the numbers. Yeah, 500,000 people have died from COVID just in the US alone, and so putting that face to the numbers, to personalize that is very important, especially. And we thank you for coming forward, because the stigma that patients and families face with COVID infection is not inconsiderable. Yeah. So thank you very much for agreeing to share your experience having been infected with COVID, and to tell our viewers what it's like. Yeah.
InsyaAllah.
Terima kasih Zai. Mungkin Zai boleh ceritakan sikit macam mana your pengalaman dengan COVID-19.
Begini, if you had invited me about even a month ago, saya mungkin decline the invitation, because you see, bila saya dengan suami saya keluar dari hospital, kami rasa macam kami nak hanya be on our own, duduk just stay home and tak nak jumpa sesiapa. Sebab kami rasa tak tahu bagaimana reaksi orang apabila mereka tahu yang kita ni dapat COVID. Lepas tu it became so sensitive that we just rather we tak nak jumpa sesiapa and all that. Tetapi recently ni people start asking questions, and and then they ask questions because they care and they are curious. Dan ada juga yang bertanya, kalau kita tak sihat, apa patut kita orang buat, di mana patut kita orang pergi, dan semua tu. So oleh kerana begitu, kami rasa okay, yes, at least in that area kita orang boleh, insyaAllah boleh membantu. Ya, dan kalau orang nak ada stigma and all that semua tu, that's their problem. So we're looking positively in how we can actually contribute. Yeah. So with how I felt apa semua tu, really apabila suami saya dan saya, we all develop fever, kita orang demam panas, badan pun selemah-lemahnya, tak boleh nak bangkit. Yeah, and then hati saya rasa macam ini ni lain daripada penyakit yang lain. Pasal berasanya lemah sangat-sangat, and also demam, very high fever, and let's just say that I was ill on a Sunday and over the weekend, and then suami saya telah diberitahu bahawa office colleague dia is in close contact dengan someone positive. Oh, begitu tu barulah kita rasa macam it confirms our fear. I mean, kita ni dapat COVID ke tidak, kerana and then of course it was very stressful bila kita agak-agak sahaja kita ni demam ni COVID ke tidak, tetapi bila kita diberitahu office colleague-nya tu positif, in contact with someone positive, kita dah rasa shock dah. Ini ni mungkin. So sebab tu kita terus buat COVID test, swab test. Monday buat COVID test, and on Tuesday kita dah dapat result. Pada ketika tu pula, kan dalam jangka 2 hari tu, badan pula rasa okey, kononnya lah okey, kan? And then tetapi to be frank with you, apabila kita orang dimasukkan dalam hospital, suami saya masuk dalam Sungai Buloh Hospital, admitted Sungai Buloh Hospital. Saya pula dekat pusat kusta, kan kami diasingkan gitu. Apabila kita masuk hospital, masa hari kedua tu, the symptoms, COVID symptoms dah mulai. Kita orang lost sense of smell, and the chest tu apa orang kata congested, hard of breathing. My husband had to be on oxygen support, and tapi yang tak larat tu adalah bila the extreme fatigue, keletihan yang teramat sangat. I remember I was in the surau alone, and I was so macam drained out, letih sangat, tak bermaya sangat-sangat. I just tersungkur kat atas sejadah tu, and terbaring atas sejadah sorang-sorang, dan I kata boleh terlintas dalam fikiran, ini terasa macam nak mati, you know. So really those few days the symptoms sangat ketara, and apa pun lagi, and then I developed fever. Pula, and along the way I was admitted for 2 weeks, because my lungs were so affected. And orang buat X-ray, the virus was just then so infected, and then so much so that bila they asked to do that breathing test and all that, I could hardly actually breathe. But to be frank with you, bila kita masuk hospital, the first thing is that we are in denial. Macam berasa, betul ke ni saya ni mengalami COVID? Tapi macam ini pengalaman sakit itu, bila kita berasa apa yang kita merasai, lain daripada penyakit yang lain. Yalah, sebab itulah COVID tu ada banyak condition, syarat dan SOP apa semua tu, sebab dia memang lain daripada penyakit yang lain. I was in denial for about few days until I kata, nak terima to have that reality actually sink in. But after going through all those symptoms apa semua tu, I said, look, ni tak boleh jadi macam ni, and alhamdulillah we received really encouraging messages from friends and family, and I received this very inspiring words from a friend, and she said, Zai, stay focused and strong, and everything will fall in place. And I said, yeah, alhamdulillah, and from then onward, I started to focus and try to think positive. I started to focus on helping others, and also, of course, listen to the doctor's instruction and all that, and that helped me survive for the 2 weeks. And of course, I lost a lot of weight because I had no appetite to eat. Itu hikmahnya lah, dan I've been wanting to lose weight. So that was what I went through lah.
There are other ways to lose weight, Zai, but thank you so much for sharing, Zai. I can feel that the mental stress that you went through is still living with you, and that is also understandable, Zai. But thank you so much for sharing that. I think what you said about even not wanting to meet people, that's quite it's part and parcel of a disease that is so new and a lot of stigmatization. And I think you had so many symptoms that that people only hear about, but now hearing you say this, even I felt short of breath. Tapi Zai, if I can ask you, Zai, were you Zai, ada tak penyakit lain? Did you have any other comorbidities?
Tak ada, alhamdulillah. I guess that's one of the reasons why they put me in pusat kusta, because those warded over there are those without tak ada yang health issues lah, kan? So alhamdulillah, I didn't have that. So syukur. My husband has hypertension, and that's why they send him far.
But still, Zai, you said a few times penyakit ni lain dari penyakit yang lain, ya. And I think that is very, very important to stress. Sebab yes, 80% of those who get the infection memang don't have much symptoms at all, except for maybe the loss of smell yang you described. Tapi that 20% tu yang can get much more severe disease as to what you described, the lung congestion and many other complications of COVID. This is what we want to try and prevent in the first place with all the fancy name we call the non-pharmaceutical interventions, the mask, the distance, the avoiding crowded places. But now we have the vaccines to hopefully reduce the severe disease and reduce the need for hospitalization.
Yep.
Before we speak about the vaccine, ada ahli keluarga lain yang dijangkiti tak?
Yes, ada. Besides my husband and I, so when we found out that kita positive, that was quite fast. Monday we went for swab test. Tuesday we found out that we're positive, and so we said to our children, please, and the grandchildren and the maids, please go and get your swab test. And Tuesday night too, we were admitted to the hospital, and then when we were at the hospital, and then we found out the first person that we found out was our 18-month-old granddaughter. That's so heartbreaking. My 18-month-old granddaughter was positive. And the fact that bila dia positive, and she's actually in a taska. So can you imagine, not only the teachers and the children at the taska, the parents at the taska, from the taska, semua had to go for COVID test, and at the same time, so when she was admitted in the hospital, of course the mother had to accompany her, but the mother was tested negative, but because the mother was at the hospital, maknya pula berjangkit COVID jadi positive. And then another daughter pula, they had to do 2 tests, so another daughter was tested positive. So sedihnya, because you see, I was in the hospital and here my family members confirmed positive. I couldn't be there for them. Kita kalau sesiapa sakit, anak, especially cucu sakit apa semua tu, we want to be there, isn't it? So that's really something that's in our mind, and that's something really sedih that,
Fortunately, young children and young people have less, risk of getting complications. But yes, of course, it's not zero. Yeah.
Yes.
Just have you recovered completely? Have you and your husband and the family members all recovered completely?
Yeah, Alhamdulillah, yes. Now the fact is, bila kita keluar, we were not able to actually get banyak advice, or what should we do and all that from when we were discharged. So there were a lot of concerns that we had, because suddenly I masih rasa letih. Can you imagine, we go for walks, and even going for walks just around the area rasa sangat penat, because our energy level memang turun, ya. And then at the same time, so you please tell me, I do have sinus, and it was about 24 years ago I had this sinus operation. But masa I dalam hospital tu, it sort of like recurred, and I had that nasty smell, kinda, and so that is what I'm going through right now. That's one of the things that I have to bear with, and I've got to see the doctor and all that for my sinus problem. But headaches. Yes, but yelah, tired lah, rasa tired tu, selalu rasa tired. But it gets better, alhamdulillah.
Masih
yes.
juga lagi?
Sikit-sikit. Now it has gone, it has reduced, but there was a lot. There was only recently reduced, rasa letih. But sekali-sekala tu rasa fatigue still,
Dah berapa lama
once in a while do that.
Since you were discharged?
I was discharged December 29, so 2 months.
Yeah. So in fact, last week, Zai, I had an interview on Sense with Science with Dr. Anusha from UK, and we talked about her experience as a doctor. Getting COVID-19 and recovering, and we talked about something called long COVID, which means, you know, some people lepas dia dapat infection COVID tu, their symptoms and their fatigue and headaches and other things, some people even have difficulty in breathing for a long time. Sebab tu COVID ni we cannot take lightly, ya. So kita kena ambil, orang mungkin rasa COVID is just like the flu. It's not like the flu as you have explained, Zai. Dan kita kena ambil precaution lah, sebab tu ada SOP dan sebagainya untuk kita mengelakkan diri daripada kena COVID. Tapi Zai, alhamdulillah Malaysia dah bawa masuk vaksin. Saya dengan gembiranya ingin mengumumkan bahawa the latest update at 3 o'clock, we have about 3 million of our Malaysians already, 3 million people already registered to take the vaccine. And the latest. Pardon?
I've taken my first dose.
And Adiba has taken her first dose, and alhamdulillah as well, to date, I can give you the latest data because I have it now. Right now, 127,608 people have been vaccinated. That's not bad for 1 week. Actually, it's quite good. So, Zai, macam mana Zai? Zai, are you interested and are you keen? Have you registered to take the vaccination?
Yes, inshallah. Yes, I am. For the very simple reason like this, yeah. But what I went through was really challenging and traumatic. All the feeling heartbreaking and all that. But it's the anxiety and the stress, yeah. That I remember when we didn't have the COVID, being afraid that could we be infected? You know, nak keluar pun, could we be infected? Are we doing the right SOPs and this kind of thing and all that, yeah. And that is orang kata sentiasa nak berjaga-jaga. Yang memanglah walaupun saya faham bila kita dapat vaksin tu kita masih lagi berjaga-jaga kan. Tetapi kalau kita tak ada vaksin, can you imagine macam saya ya, walaupun to be frank with you, kat rumah ni yang kami yang dapat COVID tu kita orang panggil outside alumni. You know, so
that's a nice way of putting it.
Yeah, we could hug each other, we can still be close with each other, you know, and alhamdulillah to that sense. But I still have my other sons and son-in-laws, my other siblings, apa semua to whom we still cannot be close. Kan, masih lagi nak jaga-jaga. I can't meet them, and that's so stressful. And I to explain to you, I mean, as an example, one of my sons ni dia memang had to kerja luar, and then each time dia jumpa orang, and then somebody ada in contact with somebody yang positive and all that, dah dia kena go for a test, and dah dia kena quarantine and all that. So it just goes on like that. How long is it going to go on that way? For us to sentiasa berasa the anxiety and the stress. So, and that's the reason why alhamdulillah, you know, my family and I, we were in discussion, and kita orang discuss apa dia pros, what are the things that we know about the vaccine and the pros and cons apa semua tu. But at the same time, kita made a thorough research to find out what vaccine is about apa semua tu kan. And we want to move on with our life. We want to reduce the worries. We want to have some peace of mind. So inshallah, because of that, yes, we prefer to be vaccinated, inshallah.
Thank you for that. We have a question, I think, that someone has posted on FB. How do we know, so sorry to interrupt, and we will, because we want to make this as interactive as possible with our viewers as well, who unfortunately we cannot see, but we know that there are people watching us on Facebook Live. How do we know our antibodies are strong enough to fight the virus? If I had COVID-19, are my antibodies strong to fight? Well, we won't be able to measure specific antibodies to know whether your antibodies are strong enough to fight or not. What we do know is that people above the age of 60, people under the age of 60, if you are overweight, especially if you are obese, if you have diabetes, and if you have heart disease, these are the things that put you into what we call the high risk category of getting severe COVID. What Puan Zai just described is horrible, but would still not fall under the category of severe COVID. Alhamdulillah, both her and her husband escaped needing, long, sort of more invasive oxygen support. But we do know that people who are overweight, who with diabetes, all that, they are the ones, and the elderly, they are the ones who can develop all those severe complications. So that would be my answer to that. There's a question, the second question is, I'm still on steroids. I'm assuming that you are on steroids for treatment of severe COVID. A very large study conducted, or at least the results released about 6 months ago, showed that steroids can reverse the severe complications of COVID due to the inflammation that happens as a reaction to the viral infection. So you will slowly be taken off steroids eventually.
Yeah, terima kasih for those questions. Let's go back to Zai for a minute, and then we can come back to more questions. Zai, do you have any questions or to both of us? I think this is the purpose of this program. Zai, or ada soalan tak tentang vaksin itu sendiri?
Yeah, because when friends and family, they found out that I'll be in this program, and they just jump, oh yeah, we have some burning questions over here. And one of the things is that is the vaccine safe for asthmatics and kidney disease stage 2 and 3 patients, and has there been any data shown?
Yeah. Tan Sri, would you like to answer, or would you like me to answer?
Yeah, go ahead.
Okay, so one of the reasons why there is a lot of hesitancy of taking the vaccine, and in particular the Pfizer vaccine, which is the first that we are rolling out, is because of all this news from around the world that there are complications or side effects from the Pfizer vaccine. Now, the one that we all need to be most concerned about is the one called anaphylaxis, which is when you get the vaccine, you may swell up, you may have trouble breathing, you may drop your blood pressure. The people who have had this reaction, this anaphylaxis reaction, either from the first Pfizer, from the first dose of vaccine, or from anything else, from peanuts, from other medications, then this is the absolute contraindication. If you drop your blood pressure, you swell up, you have trouble breathing. Everyone else, you need to inform the doctors that you have an allergic reaction. Asthmatics or people who have kidney disease, you are not excluded from having the vaccine. In fact, people with kidney disease will fall into the category of chronic, those having chronic comorbid conditions and are at risk of getting severe COVID. We would encourage you rather than discourage you from taking the vaccine. Same with asthmatics.
Yeah. In fact, there have been millions of vaccines given around the world, and we have not seen one death that is causal to the vaccine, which is very important, because sometimes you hear people saying, this person died in Norway or something, but when we investigate the case, there's no causality. It's not because of the vaccine. Some of those who receive the vaccines are already quite old, who have other diseases as well. As Prof cakap tadi, even with allergies, Prof, I think you agree, it depends on what allergy you have and how severe as well, kan? Because what people are allergic to are maybe some of the components, the diluents in the vaccine itself. Jadi kalau kita select orang untuk terima vaksin tu, kalau ada alahan, kita akan ambil history yang detail. Bukannya kata tak boleh bagi, tapi kita akan ambil detail history, dan mungkin orang itu boleh disuntik di dalam hospital atau tempat di mana kita boleh mendapat rawatan yang segera. Sebenarnya di setiap pusat vaccination pun, sekarang di phase 1 ni banyaknya di hospital, di klinik kesihatan dan sebagainya, di mana ada facilities. When we roll out mass vaccination, mungkin di tempat-tempat awam, tapi kita akan juga ada doktor di sana, ada juga facilities untuk what we call emergency treatment dan sebagainya, ya. Maybe adrenaline EpiPen and all these drugs that will be available for allergies. Setahu saya, kita dah seperti saya katakan lebih 100,000 vaksin diberi, dan ada maybe one case of allergy and then one and some very mild sort of symptoms that recovered, things like somebody had palpitations but was well after that. Someone had vomited once, but the person was actually very nauseous and anxious before the vaccine as well. So nothing serious. And there is something in Kementerian Kesihatan, kita panggil the adverse effect punya monitor. So we will be monitoring every single symptom and sign that we see. Dan kalau seseorang tu dah menerima vaksin, I think Prof Adiba can attest to this, that you will get also, on your MySejahtera, you can log in and tell, how you're feeling, and also they will give you some guidance on what symptoms to look out for, and so on and so forth. And lepas you dah diberi vaksin tu, you will be observed for a little while, so that we see if there is going to be an allergy. Normally it happens within the first 15 to 30 minutes. So that's why the observation time in here is about 30 minutes.
Only 30 minutes, is that?
Yes, because the average time of allergy will be 17 minutes. So so normally 30 minutes. But if you don't develop anything within that 15 minutes, chances are you won't develop an anaphylactic reaction, inshallah. Any other question?
Yes. Apakah kriteria KKM ni to determine yang vaccination untuk kami COVID survivor ni? What's the consideration for us?
So, go on.
Go ahead, Adiba.
So in fact, for those who have had COVID, we will still recommend that you get vaccinated. The reason is we don't know how long the immunity from your natural infection lasts for. Sebab COVID is still brand new, walaupun we seem to know so much about it. The latest data I've seen is very good immunity up to 7 months. People have been studied up to 7 months. The natural immunity is good. Tetapi we would still recommend that you be vaccinated. Tambah-tambah lagi, there is concern with all the new variants, the new mutated virus. So we want to make sure that everybody who should be vaccinated is vaccinated, including mereka-mereka yang pernah dijangkiti COVID.
So macam for myself, I had it in December. I can go for the vaccine in about by next month apa?
Yes, boleh. It said that 3 bulan, but there's really no reason kalau it's sooner or later.
Okay.
Yeah.
All right.
Yeah, I think this is also because in the past when we had the first wave of COVID, so to speak, we had followed some of the people who had COVID, and we found that the antibody levels dropped quite drastically after 6 months. So in order to protect people, even though you had COVID, as Prof has explained to you, reinfection is not entirely impossible. And particularly so when someone is older or has comorbidities that can be very dangerous, kan? So within 3 months or so, you will probably be called for, for vaccine as early as 3 months, but it can also be later. Adiba, we're getting lots of interesting questions in our Facebook Live. And I just want to tell the audience that we will make sure we answer every single one of them. And we don't get to answer it on this live show. We will make sure that they will receive the answers, and we will post it either on social media or other means. I guess social media, we are on Twitter, on Facebook, on Instagram, and we will make sure they are answered. Some of them are quite technical, so I think that will require a bit of a longer answer, but maybe we can pick up a couple. One of them is directed directly to you, Adiba. What do you think about someone who has white blood disorders with past medical history and has somehow contracted COVID-19? If the person survived and left the hospital, do they need still to have?
I think
do they still have to hurry up? Yeah.
I think we just.
I think you've answered that. No.
Yeah. There's a question here on, and this is a common question. Yeah. The concern is vaccine. All these vaccines are under 1 year old. Maknanya, it's new. Sebenarnya, none of the vaccine platforms, sebab there are many different types of technology. Of course, the most well-known is the mRNA, Pfizer, BioNTech. And everyone thinks that it's new. Sebenarnya, the technology has been in existence dah berapa tahun, and it's been used for several other, or been studied for several other viruses. Ramai orang tertanya-tanya, how come dalam penyakit-penyakit lain it takes 5 tahun before we can find a vaccine, tapi with coronavirus sebelum cukup 1 tahun dah ada bermacam-macam vaksin. And the answer is sebab the technology that's being used memang sudah in existence, dan keduanya the coronavirus is not, although SARS-CoV-2 is a new virus, tapi the family that it comes from is not new. There ada beberapa coronavirus yang in existence. Of course, the other one is the SARS, the original SARS, I call it, the MERS infection yang dari Middle East, and common cold dan sebagainya. So there are teams of scientists all over the world studying coronavirus. So bila this new virus was discovered, everybody then just pivoted and started doing research and realized that a vaccine must be found as quickly as possible. So that's number one, that the family that it belongs to is not a totally new virus, not like katakan macam HIV 40 years ago. Kedua, a lot of investment by governments dan juga by pharmaceutical went into, so everybody worked around the clock to try and produce the vaccines. And then ketiga, because a lot of people are infected, so to do the clinical trials, it was a lot easier to recruit participants and get the results. It's about tens of thousands of people are infected. So rest assured, the vaccine yang approved by NPRA dan that the government is using have all gone through the phase 1, phase 2, phase 3 clinical trials before we use it in people. Now, there's a question here, what about side effects that will happen in maybe 2, 10 or 20 years from now? Well, we cannot guarantee that there's no side effects, but from many different types of vaccines from other viruses that we give injection, we immunize people for, whether it's typhoid or whether it's tetanus, polio dan sebagainya, late occurrence of complications is very, very uncommon. Yeah. And then, as you've already heard the description from Puan Zai, this disease is a terrible disease. So if you get severe COVID, your chance of dying is not inconsiderable. Yeah. We need to weigh the risk and the benefit. And I can tell you that the benefit of the vaccine far, far outweighs the risk.
Yeah, also, I think one of the things many people fail to recognize as well is that when you're given the vaccines that we have today, there's nothing that will cause the infection. There's all killed vaccines or the mRNA platforms, as Adiba was mentioning earlier. So it's not like you're injecting a live vaccine into your body. This does not happen. So there's some questions that I think I can take. One, particularly around women having planning to have children, or whether they're pregnant and breastfeeding. Well, so far, there's now some research going on to look at the safety of the vaccine among pregnant women. So we're waiting for results from that. But in the meantime, the US, the UK sudah keluar advisory bahawa wanita yang hamil boleh menerima vaksin itu jika mereka mempunyai risiko untuk mendapat COVID. Itu utamanya wanita yang bekerja di ward ataupun di pekerjaan yang ada banyak exposure to public or potentially COVID positive patients. So it's a matter of choice. But dalam vaccination yang berlaku di negara-negara barat, ramai yang terima vaksin tu tidak tahu mereka hamil pada masa penerimaan vaksin tu, dan so far tak ada complications. There's no miscarriage or anything. So I would think that it is safe, but soon we will get much more evidence on this. But in the meantime, if you are a nurse working in intensive care, or someone working in an elderly care home, or someone who is really at risk, then you might want to consider taking the vaccine. I think that's not a problem at all. At the moment, the evidence is very clear for that. There's also a question, which is a good question. What is the interval between the first and second vaccine? And it depends on the type of vaccine that you receive. Misalan for Pfizer, it will be 21 days. But in the UK, just to share with the audience, Pfizer vaccine and AstraZeneca particularly has been shown to be effective even after 9 months. There is a immune response measured even after 9 months. So this is from the research side. Jadi di UK, untuk mereka memberi vaksin dengan seramai yang possible, maknanya they want to vaccinate as many people as possible, they have, instead of using the recommended dose in Pfizer is 3 weeks, they stretch it to up to 12 weeks supaya more people can get the first dose, because just getting one dose itself has been shown to create a very good immune response. And in Malaysia, we are still following the regime, because that is in the it's part of our deal as well, right? With Pfizer, that you use the drug according to the schedule. And in Malaysia, we have ordered enough vaccines and a wide portfolio for us to be able to cover, our Malaysian population. So I hope that, when you are, first of all, I hope audience will register for the vaccine quickly. And when you get called up, please come for the vaccination. Yeah. So mungkin we go back to Zai. Zai, ada soalan, anything in particular, Zai, that you want to ask us?
Yeah, at the moment kita ada Pfizer, isn't it? But does it not matter? Does it matter that which vaccine that we get? Because I heard there's sliding scale of the effectiveness of the different vaccines. So is that true?
Very, very good question. A lot of people are asking this about, the scientific data says, the Pfizer and the Moderna, the mRNA technology vaccine have this 94% efficacy. Kononnya the Johnson & Johnson is less efficacious. But you know, in countries that are using these vaccines in a very, very big way, what is important is we want, I mean, those are clinical trial results, yeah, where they watching this very, very closely. But when other vaccines are used, the impact at a population level, even though katanya it's only 80% more, 80% efficacious compared to the 90% efficacious, it's still 80% prevent you from getting severe disease. So the pokoknya, you should get whatever vaccine is offered to you as quickly as possible. Yeah, it's not that one is not as good as the other, really.
Yeah, and it's also about, as you mentioned, Adiba, the herd immunity that we want to make sure that the community is also protected. Sebab when you are protected, then you can, you know, others. Yeah, but don't forget, WHO criteria, Persatuan Kesihatan Sedunia, only sets it as at least 50% efficacy for vaccine to be used. That's the criteria that they set. But so far, all the vaccines that are out there in the market are way above 50%. So you can be assured that any vaccine you get is good, right? You should take any vaccine offered to you.
Yeah, that's the
I want to go back to the question, if you don't mind, on the pregnancy. Sebab Tan Sri, because a lot of people are still ragu-ragu with this pregnancy issue. Whilst you were talking, I quickly looked up the Centers for Disease Control US punya database, and it would appear that as of February 10, 2021, 11,764 women with completed pregnancies have been reported having received the Pfizer vaccine. I mean, the Pfizer or the Moderna vaccine in the US. And so total birth outcomes among these pregnant women, 11,964, 11,849 were live births, 115 pregnancy losses, but that's not different from normal incidents. So there are, you know, there's very close monitoring of all these women who've received the vaccine during pregnancy.
Yeah, in fact, CDC, WHO, the Royal College of Obstetricians and Gynecologists in the UK have all come out with advisories that do not sort of say you cannot take the vaccine. It's all case-to-case basis in discussion with your obstetrician and gynecologist, and you know, looking at your weighing your risks and benefits of the vaccine. So, you know, don't apply a blanket. You cannot. And KKM is also coming out with the same guidance as well.
The thing worth noting is pregnant women, just like those with diabetes, unfortunately have higher risk of severe disease.
Semasa hamil, you know, our immunity actually drops. So that's why, you know, women who are pregnant must be protected. This is it's very important. They're at higher risk as well. So, Zai, do you have anything else for us before we go back to the audience questions?
Two, how does the government choose who to vaccinate first, and and vaccination for children, because they are also at risk, you know, and especially the school-going children. So how come children cannot be vaccinated? How can we assure that they are protected?
Sorry, my cat came in the way. Yeah, I think on the vaccination plan, basically the first priority is to get our healthcare workers and our frontline workers vaccinated. And this is ongoing. There's enough supply right now. In fact, we have enough for 500,000 people in phase 1. Which is from the start until April, where we will ensure that, you know, we have about close to 300,000 healthcare workers, plus, you know, other frontline workers like policemen and military and so on and so forth. And then we decided as well that, you know, some of our leaders, for example, our members of parliament who are out there with their constituency, but also to give some reassurance to the public, right? If the leaders take the vaccine, we hope that it will inspire and give confidence to the rakyat that it is safe to take, because you know, we can't just tell people to take and then we don't take the vaccine, right? So that's phase one. Then one thing I want to stress is the phases are not consecutive. They are actually all bertindih. As the vaccines will come on a weekly basis, so more and more supplies will be coming in. Every week we get a supply from Pfizer, every week. And then soon we're getting our supply from Sinovac. And then later, hopefully, we will get our AstraZeneca and others. Then when these vaccines come, when we finish with the as I said, the frontline people, we will then quickly accelerate into others, right? So of course, as tadi kita bincang, those with comorbidities, those who are older, they are also very important for us to protect them. So when we look at the vaccination programs, kita look at two levels. One is at the individual level. Who are the population at risk? And then the next we need to start looking at is the communities at risk. Jadi dalam kita punya vaccine strategy itu ada satu group yang kita sebutkan how you want to actually manage pandemics outbreaks, right? So kalau kita tengok sesuatu kawasan tu memang very high incidence of COVID-19 infections or an outbreak there's a possibility then we will quickly isolate that group and vaccinate as well. Sebab kalau tidak, it will spread, you get more and more people in the area. So all I want to assure everybody is that we will have to accelerate our vaccine program soon. After the healthcare workers and the frontliners are done, the vaccines will also be given to the GPs and others, and all vaccines are free. So then when you get your alert, you may actually get an alert to go to a GP to get your vaccine, or even a small stadium. So wherever you are asked to go, you go, and you do not pay for your vaccine. This is very important to note. And then on children's that's a very good question, because you rightly pointed out that we want to protect our children as well, and they also get sick. But what we have found is that there's not enough research, first of all, and currently there is a trial going on with children, and until we get evidence that it is safe for children, we don't recommend that these vaccines are given to children. Adiba, do you want to add anything on that?
Yeah, I think the issue in children is one, the vaccine trials were not done in children, as Tansi said, and but now I think AstraZeneca has going to be enrolling students, like children, in the trials. And secondly, although we know that the disease is not zero, there is key complications to children, but they are more likely to have either no symptoms or very mild symptoms. So the risk of getting complication is much lower in children than in adults.
So those taking care of the children should be vaccinated then, isn't it?
So that's why I think the government has considered teachers to be, in the priority group for vaccination sooner or later.
I think I want to address two things in the questions. Someone asked a question to me: since over 3 million Malaysians already registered, will KKM try to clear this queuing Malaysians soonest? Yes, I think so. We will. We're not going to wait. We're going to try and clear as many people as possible. Now, to the person who keeps calling out about the Norway case, I can assure you that all scientific evidence points to the fact that it was not causality. This is very important to note. Every year people will die, and the important thing is whether they die because it's a direct effect of the vaccine, and to all the scientific evidence points out to the death not being as a result of the vaccine. So causality is extremely important.
So there have not been anything, any facts known about anybody dying from vaccine, isn't it?
So at this moment, all the scientific evidence we receive has shown that there's no causality link.
Causality link.
That means the vaccine doesn't cause the death, right?
Okay.
So, you know, yeah, so you could have a underlying heart condition or something, and then you receive the vaccine as well because you're a high risk group, but you die because of the heart disease, right?
Okay.
Yeah.
Right.
So anything else, Zai, while I scroll the questions?
I think, why don't you try and answer them first?
Sure. Yeah. So there's a interesting one. I guess we have someone from Jakarta watching us. Thank you for that. Someone's asking that if someone's from abroad, like me in Jakarta, coming to Malaysia, can I get vaccinated there? Because we have a different vaccine here. So to our friend in Jakarta, please take your vaccine in Jakarta. Whatever, I know in Jakarta, they're using Sinovac widely, and they've given to millions of people already with good effect. At the moment, our vaccines are for anyone who is living in Malaysia. Right. There's a question around, I think,
quite a few questions
HIV/AIDS. On HIV/AIDS, Adiba.
Allergies. Yeah, a question on HIV, but before that on allergies, because I think that's more common, like what we said before. Unless you have what's known as anaphylaxis, where you drop your blood pressure, you have this severe difficulty breathing in your face, swell up. Those with mild allergies, please let your please register as having allergies and tell the people at the vaccine stations that you have allergies. You'll be watched for at least 30 minutes, but it's not what we call a contraindication to getting the vaccine.
Yeah. There's some good questions here,
HIV, we would encourage you to be vaccinated. We definitely would encourage you to be vaccinated.
Sorry, I interrupted. That's a really important point as well. And I'm glad that, you know, the Ministry of Health is coming up with guidelines that HIV patients can get the vaccines and be vaccinated. There's a really good question here, two questions. One is about, you know, whether you need an annual vaccine after COVID, after your COVID vaccine, and another one about whether you need a booster shot. So you want to give that a go, or you want me to take it?
Go ahead. Yeah, happy to chime in.
I think on the annual vaccine, currently, WHO has already sort of mentioned that there's a possibility, but it's not, you know, there's much more that needs to be done in terms of understanding the science and the data, obviously, whether this could be endemic, like the flu, right? So if it is endemic, then just like the flu, every year you take a shot. Right, but at the moment, the evidence is not yet sufficient for us to recommend that. On booster doses, I think one thing maybe to add. The companies that are producing these vaccines are continually researching, continually looking at the evidence, continually looking at what's happening in society. And what's happening is that, you know, if there are modifications to the vaccine that can be done, they will do it. So there'll be a continual improvement, right? For example, Pfizer now, initially was required this ultra cold chain of minus 80 degrees. And now, you know, they've been able to make it more heat stable, so it can go to minus 20. So this is very good, because then your transport of your vaccine and so forth. So I think that if they and one of the things about viruses, they're very naughty because they like to mutate. So they tend to you know, change their form, and as a result, it is possible in the future, if we do discover, you know, some viruses that are particularly difficult, booster doses may come into the market. We are not sure yet, but this is something we have to wait and see. Adiba, you want to add on to that?
Sorry, I was looking at some of the questions. Do you mind repeating it?
I'm talking about, you know, as there are viral mutations, you know, that there could be, you know, booster doses in future, but at the moment there is no evidence for that yet.
Yeah. So for now, it's two doses. Of course, we need to keep a close eye on the development of the different variants, the mutations that we are seeing, and what impact that will have on the virus, on the vaccine. So all this, there's emerging and new science every day that we have to keep up with and make recommendations based on the latest available evidence. Yeah,
Absolutely.
there was, this can be answered very, very quickly. The vaccine is free, including the second dose. Yes. Can you clarify whether the rakyat can choose the vaccine? No. You will have to take the vaccine that's offered, because if you say no, thank you, then you will go back in the queue again, right? So
Yeah.
we want everybody to be vaccinated as quickly as possible.
So believe it or not, we have just sailed through the hour with Zai, and I think we've had really amazing questions. So thank you so much to the audience for that. As I mentioned before, there are questions. Every question we will look at. If we can't answer it, we'll get the experts to answer it for you, and we will put it up on social media and other channels. But first of all, Adiba, I think we should thank Zai. You know, Zai, I just want to say, it was so touching to hear from you and your honesty, and we could feel it. And thank you for wanting to help. I think I'm so glad that you didn't hide yourself away, because there's nothing like someone who's walked that journey to share how difficult it was, or how important it is to be safe and to protect yourself. So terima kasih Zai kerana berkongsi dengan tu. Ini satu amal pada hari Ahad ni Zai kepada semua rakyat ya. And I just want to say to all the audience that we are doing this. This is our first Facebook Live, isn't it? This is the experiment, but normally every week we drop a video where Adiba and I, or me alone, will talk to someone on different topics on COVID-19, and really debunking some of the myths and using science and evidence. If we don't know the answer, we will get the answer, and we will get it back to you. But please tune in to our regular channel, and I hand over to you, Adiba, for the last words.
Yeah, so I share with Tan Sri in thanking you, Puan Zai, for sharing that very powerful personal experience. I think, Alhamdulillah, even though you had a relatively uncomplicated disease, but it has affected you in so many ways. You are still affected by it, we can tell. You had the lingering post-COVID symptoms of fatigue and tiredness, and this is the problem with COVID. You had so many members of your family infected as well, and again, Alhamdulillah, none of them had severe infection, but any one of them could easily have had severe disease. So like I want to use your words, COVID ni lain dari penyakit lain, because one, ia sangat senang dijangkiti, terutamanya oleh mereka yang ada yang juga dijangkiti but don't even know that mereka dijangkiti. Dan kedua, in 20% of people, the disease can be very severe dan boleh juga membawa maut. So it's not something to be pardon the pun, sneezed at, and that's why the world over, everyone has put in a lot of effort to try and prevent the severe disease through this vaccination. So please register, and when you are called up, please get your vaccinations. I had my vaccination last Monday, Alhamdulillah, because I'm a frontliner. I look after patients with COVID. I had a bit of tiredness for the first 2 days, and I'm looking forward to being vaccinated again in 2 weeks' time, so that I'm 90% protected, from severe disease. So thank you once again, Puan Zai, and our viewers for joining us, and we will try and answer your questions through Facebook or through the webpage. Yeah.
Okay, if you like us, please follow us. Thank you, everybody. Assalamualaikum, and have a nice evening.
Waalaikumsalam.
Bye, Zai.
Bye. Thank you.
Bye, Adiba.
Bye.